Hey everybody, my name is Chuck Gilboy. I'm a business advisor with the Small Business Development Center, and joined today by the Governor's Recovery Friendly Workplace Initiative and Samantha Sam Lewandowski, who does a great job running that program. And she's going to walk us through the great resources that they have to help employers learn more about how to help their employees and how to grow their workforce. So with that, I'm going to turn it over to her.
Thank you so much for that introduction, and thanks so much for having us out. It's great to connect with everybody, and thanks for being here with us today. So a little bit about myself. So again, I'm the Assistant Director for the Recovery Friendly Workplace Initiative. Previously, I was one of our initiative's 3 recovery friendly advisors who work one-on-one with each of our participating workplaces. I also hold a Master of Science in Community Development and Applied Economics from the University of Vermont. And I'm also somebody who has been indirectly impacted by substance use disorder. So while I myself do not have a substance use disorder, more commonly referred to as an addiction, I have a loved one with a substance use disorder. And today, what are we going to be talking about? So we're going to be talking a little bit about what New Hampshire's Recovery Friendly Workplace Initiative is and why it's good for business. We're going to talk a little bit about the RFW process, RFW culture, and corresponding strategies for implementing that culture. We're going to talk about recovery friendly related resources. And then we're going to be very fortunate to hear from one of our actual recovery friendly workplaces, Chameleon Group, and we have 2 people on from that business, and I will let them introduce themselves a little bit later, and they'll talk a little bit about kind of the employer and employee perspective of being a recovery friendly workplace. And then we'll have some time for questions, and you can also pop those in the chat as we go along.
And thanks, Samantha. And I'll pick up here just very quickly before we get started on the SBDC and what we do. We're an independent organization, but we're a cooperative agreement between the Federal Small Business Administration, the state of New Hampshire, and the University of New Hampshire. And we're what's called an official resource partner of the SBA, along with the Center for Women in Enterprise and SCORE, the Corps of Retired Executives. And so what we do day in and day out, we've got almost a dozen advisors around New Hampshire, and we provide individualized advising and educational programs to companies with less than 500 employees in any industry or stage at no cost to businesses. So we're hosting this webinar today, which we know is going to add a lot of value for you, but also encourage you, if you're interested in these issues, obviously work with Sam, but also just workforce development in general. We've got a lot of great advisors on staff who can help you with everything from A to Z. So encourage you to visit our website and sign up for individualized advising as well. That's what we're here for, and we're happy to help.
All right, jumping into an overview of Recovery Friendly Workplace. So before we get into that, I want to just make sure we kind of all have a general understanding of what the initiative is about, which is helping people who have been impacted by substance use disorder. So according to the American Society of Addiction Medicine, they adopted the following definition of addiction in 2019. So addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. They also go on to note that prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. And I just wanted to kind of highlight this part around using substances or engaging in behaviors that become compulsive and often continue despite harmful consequences. I think especially if you're a loved one who's going through this, or even if you're going through this yourself, it's kind of like you might see this person hurting themselves and kind of wonder, why do they keep doing this? It doesn't make sense. And it's actually a symptom of the condition that there's kind of this compulsive use despite those harmful consequences. It's not something that the person wants to choose. It has to do kind of with some of what's going on in the brain and some other things as well. It's really complex. We provide some additional training around that, but I kind of wanted to provide that very brief overview of what it is we're talking about. A little bit more about the Recovery Friendly Workplace Initiative. So it is led by Governor Sununu. It was launched in March of 2018, and we've grown a tremendous amount since that time. It is an initiative that's really designed to promote the health, safety, and well-being of New Hampshire workplaces and employees. And more specifically, we do this through empowering workplaces to provide support for employees who are in recovery, maybe for those who are seeking recovery, or who are impacted by substance use disorders in general. So that includes loved ones. A huge part of this work is challenging the stigma around substance use disorder. So what we're really trying to do is make it easier for an employee to say, this is something I'm struggling with, or this is something I need support with, and then the business to be equipped with some tools and resources to be able to support that individual. And we think that when a business is able to do this, it's really a win for not only the employee, but also for them. For example, we think that doing this kind of work and kind of making this investment in your employees will help encourage employee retention and productivity. A little bit more about how we support our recovery-friendly workplaces. So I just wanted to note that we offer a customized approach. We are very aware that what a small mom and pop shop might need is probably a little bit different than what a large manufacturer might be looking for. We provide connections to statewide and local resources. We have an internal database of a lot of tools and materials, and we're constantly adding to that. So we kind of curate a selection of resources for each workplace. We provide support for employees and also their loved ones. We provide over 10 different no-cost trainings. We are able to share policy resources and samples if desired. Another huge thing is providing connections to peers in the state. So a great example of this is having Chameleon Group on today. You know, a lot of businesses want to hear from other businesses, and that's something we're really passionate about, is making those connections. We also provide some support if people are looking to create a recovery-friendly workplace committee or do some surveys or listening sessions to kind of get more information about their workplace culture and how they might implement this. We also provide workforce development connections, so to programs that help employers get connected to employees. And we also provide ongoing dialogue and structure around this process to make it a little bit more concrete and streamlined. And why should employers get involved in this effort? So what we like to point out to businesses is that whether you know it or not, you're very likely already employing those who have substance use disorder or who are in recovery. So in New Hampshire, there's over 135,000 people who are in recovery. Nationwide, there are over 20 million people who have a substance use disorder, which is about 10% of our population. And in addition to that, in 2017, there's a statistic that about 9.1% of people resolved a substance use disorder in the past year. So we can roughly think of that as those individuals being in recovery. So with that altogether, we're looking at about 20% of the population, and that doesn't even include all of those who are indirectly impacted. You know, if you wanted to branch this out to include behavioral health as a whole and mental health and other behavioral health issues, that number just really skyrockets. Also, work is where we reach people. So if you think about kind of a lot of our lives, we spend a lot of time at work, and if we're not at work, we're at home. And if we kind of think about this from a public health lens, once people are at home, it's a lot harder to reach them in terms of getting information and resources and help to them. So work is actually kind of this amazing space where we can effectively get people connected to help. We already talked about the direct and indirect impact of substance use disorder. And I think one of the coolest benefits that I've heard about from a lot of employers is just being able to retain talent. So once you know how to kind of help somebody, instead of just having to go to maybe letting them go or kind of one strike and you're out, kind of an old school mentality, you can get them connected and bring them back. And that of course saves on turnover costs, which are, you know, very costly for businesses. A couple of additional benefits include things like seeing increased productivity, better employee health and morale, better communication and a more transparent workplace, more employee satisfaction, more connections to the community, and even more customer loyalty. And then we anticipate seeing decreases in things like absenteeism, turnover, and impact on families. Here's some statistics about how workers in recovery actually save companies money. So workers in recovery help employers avoid over $4,000 in turnover and replacement costs. Workers in recovery miss 13.7 days less per year than workers with a substance use disorder. And each employee who recovers from a substance use disorder saves a company over $8,500 on average. And these statistics come from the National Safety Council. Additionally, people in recovery as compared to the general workforce miss, as you can see, 9.5 days as compared to 10.5 in the general workforce. So they're actually missing less than their counterparts. And the turnover rate is 21% as compared to 4% higher at 25% in the general workforce. So they're actually outperforming there. I just wanted to mention kind of a brief case study around recovery friendly workplace. And this comes from Genfoot America. This is one of our manufacturers up in the North Country. Technically, according to your definition, would be a small business. So since they've become a recovery friendly workplace, 5 employees have come forward and identified that they needed help. They have begun hiring from local recovery homes. 2 of those people are now shift leaders. The plant manager speaks so highly of them and says they're the kind of people where, you know, at the end of the day, I would feel totally comfortable tossing them the keys and saying, go ahead and lock up, turn off the lights, and then just kind of having that trust in them. They have formed a helping hands committee to kind of advise on the implementation of recovery friendly workplace. They have seen decreases in accidents and injuries, lost days, and light duty days. And so while, you know, the data that they have, you can't necessarily tie exactly to causation like they did RFW, and these things happen just because of RFW. They do definitely attribute these trends in part to becoming involved in RFW and kind of making their culture very open and supportive. Some key accomplishments of the initiative to date. So we have close to 280 workplaces participating, representing around 70,000 employees. People have been engaged in RFW activities nearly 15,000 times. We've done outreach to around 15 to 20 other states. We've built out over 10 trainings, and over 170 businesses have been trained by RFW. And then now we will talk a little bit about kind of what's the process of becoming a recovery friendly workplace, what does the recovery friendly workplace culture look like, and what are some corresponding strategies. So first, I will just note the process that all of our workplaces follow in order to become a designated recovery friendly workplace is to go through the simple one-page checklist. And so the reason I love this checklist is because it's about so much more than just checking boxes. So we actually pulled from a lot of research and sources around initiatives related to workplace well-being and health, and then kind of tailored it for substance use disorder. And so when you go through the checklist, what you're doing is kind of honing your culture. And so the items look like submitting a letter of interest to join the initiative, doing an orientation to the initiative with one of our recovery friendly advisors. So like I said, every business that participates gets assigned one of those recovery friendly advisors to kind of guide them through this process. Then you would do a declaration to your employees stating that you are participating in the initiative and what that kind of means for you. And then you get an initial recovery friendly workplace designation. And from that time, you have another year to kind of move into this middle section of the checklist. So that looks like getting information and resources out to your employees, getting connected to your local recovery community organization, which will provide peer-based non-clinical support, reviewing any related policies that you may have, participating in some kind of annual education and training during the year. And then some optional components include, like I said, developing a committee, participating in some kind of community-based event, and any kind of customized thing that you want to do. So for example, one of our workplaces, it's called Teetotaler. They are a small LGBTQ plus friendly cafe located in Somersworth, and they actually wanted to bring like an all recovery meeting on site so their employees could access it, or a patron could access it. And so we love seeing kind of all the ways our workplaces get creative with this. A little bit more about some of the trainings that we offer. So I have broken these down according to training format. So whether they are in person, so before COVID, we were pretty much only doing in-person trainings, but they can be done over Zoom, or we are starting to get back out in the field more now. In person or online meaning self-paced. So we recently built out a learning management system so our participating businesses can get access to that and then get their staff trained. And then we also have some new content that's coming out that's just online currently. So I don't know if I need to run through all of these right now, but I can maybe highlight some. So this one is really foundational, our substance use disorder, Stigma 101 training. We also have this one around accessing resources in New Hampshire. We have this training where we teach people about Narcan, and we can actually partner with some local organizations to equip workplaces to carry Narcan on site if they're interested in that. For those of you who don't know, Narcan is a medication that is used to reverse the effects of an opioid overdose, and it can save lives. We also have two different panels that we can offer. So one of them is our lived experience panel. And so that's when people who are either in recovery or who have been indirectly impacted get together to kind of share their stories and resources and tools that they've used along the way. Very impactful. This is our business panel. So that's a panel of business leaders, whether they be a manager or an HR, talking about their recovery-friendly workplace journeys, processes, policies, practices, and outcomes. And then in terms of some of our new content, so we have this diversity, equity, and inclusion for New Hampshire workplaces that was made for us by Deo Moano Consultancy. Kind of exciting. He's based out of New Hampshire. We have this module on identifying and supporting employees with substance use concerns. We get a lot of questions around this topic. And then this is one that's in development currently that we're pretty excited about, how to support a loved one with substance use disorder and keep taking care of yourself in the process. Here are some elements of a recovery-friendly workplace. I like this just because it's kind of a different way to conceptualize it, and it's a nice visual. So first and foremost, you want to make sure that your employees are protected. So a lot of that centers around confidentiality and making sure that your employees have a safe space to come forward if they are going to disclose that they are struggling with something, and that they kind of know or have had the opportunity to learn what the process is once they do come forward. You also want to include the voices of people who have been impacted directly and indirectly if they are comfortable with that. Or, you know, as your culture progresses, you might find that people become more comfortable self-disclosing or self-identifying. And it's just really important to kind of align your work to make sure that it's meeting the needs of people who have been impacted by this. You also want to empower people to know their rights around substance use disorder. So again, this kind of intersects with education, but you know, what does the ADA say? What are your company's policies? You're also empowering them in the sense that what the workplace is really doing is kind of removing barriers to accessing help and support and empowering employees to be able to take the steps they need to take care of themselves. And then you're also providing education, especially focused around challenging stigma and making sure that everybody kind of understands substance use disorder and understands ways to be part of the solution and kind of support others. And as you do these things, you know, these are really great elements, I think, of any workplace culture. And so even though it's focused on substance use disorder, behavioral health, recovery, you'll likely find that it kind of has these trickle out benefits. And I wanted to just kind of highlight that overall, this is just a culture of support. That's what you're kind of trying to go for. This is a quote that comes from an RFW employee at GenFoot. And he wrote that every time I walk into work and see that symbol, our recovery friendly workplace symbol, it gives me a little more hope that people do care, which such an awesome thing to hear. And he is really a terrific asset to GenFoot. A little bit more about challenging stigma. I noted that that is, a huge part of this work. And when you sign up for a recovery friendly workplace, you really are becoming part of a movement. And even if you're already active in this space and doing a lot around it, we say, come on board. It'll be relatively easy for you, but let's have you become a champion, and let's have you become a peer, and let's have you just be part of the statewide network and movement to kind of support employees and reap the associated benefits. So the reason why it's so important to challenge stigma is because less than 15% of people with a substance use disorder go on to access treatment. And the reason for that, some of these people don't need treatment because maybe their substance use disorder is a little bit more mild, or they do something called natural recovery, where they don't utilize formal supports. But many studies have shown that the biggest reason people don't access treatment is because of the stigma around substance use disorder. Illicit drug use is actually, I believe, the 4th most stigmatized health condition in the world. And so stigma is really, like, not to be dramatic, but it's true. It is killing people. It's keeping people from being able to come forward and saying, I have this chronic health condition and I need help with it. And what it does is we see, people can stigmatize someone else and other them, and that person can also internalize that stigma and that shame and kind of other themselves. And so it can kind of work in a two-pronged approach that way. And one of the realms in which we see stigma kind of really concretely manifested is in the language that we use. And so when we change the language that we use, we can have a direct impact on combating stigma. And so I just wanted to kind of highlight this. We do a full-blown language training in our substance use disorder and Stigma 101 training, but I wanted to just highlight maybe a few of these helpful language swaps that you might consider making. We always, certainly respect people who are in recovery to tell their story and use the language that works for them. We just always invite people to kind of consider the audience. And what I took out of this presentation is there's actually some studies that we go through on the impact of language and how it can add to or take away from stigma. And then just like any other language, it's a language, it takes practice. It's not really about calling people out for not using the right terminology, but rather just about kind of becoming more aware of different options you can use and practicing that. And then one last note is that I will say that overall this language is what we call person-centered or person-first language, meaning that you take the person and you literally and figuratively put them in front of the condition that you're talking about. So kind of affirming that they are a human first and foremost. So you might commonly hear terms like addict or junkie or druggie. And so instead of saying that, we could say that they are a person with a substance use disorder, recognizing that, again, they are a person first and foremost with a medical condition. Instead of saying alcoholic, you could say person with an alcohol use disorder. Instead of saying ex-addict, you could say person in recovery. Instead of saying felon, you could say a person with a felony or a person who is justice involved. Instead of saying that somebody relapsed, you could say that they had a reoccurrence. Instead of using language around, drug screens being clean or dirty or staying clean, you can say things like maintained recovery or had a positive or negative drug screen. So, words having to do with clean and dirty are really kind of Puritan and wrapped up in these kind of earlier connotations around morality. So the more we can kind of shift away from that, kind of the more neutral it is. Instead of saying substance abuse, you can say substance use or misuse. So abuse is typically something that we can only do to something else that's alive. So we can't really abuse substances. And when we say things like substance abuser, that term is so negative for us that we automatically kind of, even if it's subconsciously, start kind of thinking of that person as being very bad and immoral. And then instead of saying that somebody committed suicide, again, committed has these connotations with crime and doing something sinful and illegal, we can just say that they died by suicide. So a little bit more about what employers can do. So you can develop and implement a process for your recovery-friendly workplace. So some people are much less formal with this, and some people like to have more of like this plan in place, like we're going to sit down and talk with our managers, we're going to do a survey, we're going to get the results of the survey, we're going to then implement a program, we're going to reevaluate, and then kind of continue that process. Other people just kind of want to jump right in. So you can think about what kind of process works best for your workplace. Like I said, some examples include forming a committee, doing a survey, a focus group, a listening session. One thing that you can strive for is having parity in your policies. So again, we see that substance use disorder is a chronic health condition. It's also a public health issue on a broader scale. And so when you're thinking about your policies, thinking about, you know, am I treating someone with a substance use disorder like I would treat somebody else with another health condition? So for example, if I'm going to let an employee take an hour off to go to a doctor's appointment, maybe I would consider an employee taking an hour off to go to a recovery meeting because that's what they need to do to kind of work on their health and well-being. You also want to make sure that your supervisors are trained and that you kind of have their buy-in and their support, because what you don't want is to message that you're a recovery-friendly workplace, but then not really have that being implemented throughout your culture. You want to reduce the risk of injury. So when you do this, you reduce the chance that somebody would be prescribed or end up being prescribed an opioid for pain relief, which could then become habit forming. And, you know, some of this varies by sector. So for example, like in construction, especially, that's like a big thing to watch for. You can participate in prescription drug take back events. So every year there is a prescription drug take back day. And I believe you can also just go even throughout the whole year to your local police station. A lot of pharmacies also have places where you can bring back prescription medications. You also might be able to partner with your local public health network to get doTERRA bags or prescription lock boxes and kind of make it an event or something that your employees can take with them to kind of safely store or dispose of their medications. You can also carry Narcan on site. So we do have a story of one of our employers did a Narcan training with us and chose to then have some Narcan on hand, and many of our employers choose to do that. And they were actually able to save the life of an employee who had overdosed, since they had done that training with us and had that Narcan on site. So that's pretty powerful. And supporting employees with substance use concerns, the recovery-friendly approach, a little bit more about kind of some of the strategy behind this. So a lot of our employers are interested in knowing signs and symptoms. And while that may be helpful, and I included a link to a one-pager that we have, but you can also do some additional searching online to get even more information on signs and symptoms. The best identification practice is to have open and honest conversations with employees in a safe, supportive, and recovery-friendly environment. Creating this environment is key to becoming a recovery-friendly workplace. When holding space for conversations about substance use concerns, remember to be open and honest, show empathy and compassion, and remember that this isn't about you, this is about your employee. I mean, it's about you in as far as it affects the workplace, but I think sometimes we all can come in with our different connections to substance use disorder and different perceptions around it. So you're trying to leave kind of some of that at the door. So leave judgment at the door. Have a plan and resources, and offer tangible support. And we will talk about some resources in just a couple of minutes here. In terms of encouraging conversation, so it does take intentional thought and action. Be sure to implement a policy that provides job security and mechanisms to engage recovery support services for employees that are open and honest about their substance use. Don't punish employees for disclosing they may have a concern. Obviously, then people wouldn't want to come forward, and it kind of can contribute to the stigma. Having said that, it definitely is okay to, be transparent with your employees and to hold them accountable, and to have a plan that involves them putting in some work or taking some steps to pursue or maintain their recovery. But really, it kind of comes down to what's kind of the tone that you strike. Identify different leaders and team members who are recovery allies that are trained to have these types of conversations and know what to do when they occur. And adopt an approach of consistent, supportive follow-up rather than punitive employee monitoring. And I wanted to share this. I found this actually on LinkedIn, and I really like this quote. So the story was basically that there was an employee that was having some performance issues, and she hadn't felt comfortable coming forward and disclosing it. And her manager was starting to be like really hard on her, and they were talking about maybe firing her. And so she connected with another mentor or leader around it. And what had been going on was that her daughter was being harassed at the bus stop. So she was actually driving her daughter to work each day, but she hadn't felt comfortable saying that. And so this human resources person wrote a few takeaways. Her manager needed a dose of humanity. Be approachable, listen, try to put yourself in your employees' shoes, build trust. Being more human can help you retain your valuable employees. Having happy, respected, productive employees is a win-win for everybody. Remember to keep the human and human resources. And I just feel like that really well aligns with what we are trying to do as well. So after identification and disclosure, so once you kind of have your culture in place, you're fostering these courageous conversations, it's really important that you have formal plans and policies in place to support employees who identify as having a substance use concern. Key items should include developing recovery-informed leave of absence and return to work policies, communicating and even over-communicating about the importance of employee health and wellness. So it's very possible that people will kind of hear about this, and if you just touch on it once, I think sometimes people think it's like too good to be true, or it maybe doesn't feel real about them. So having some kind of consistent messaging around what you're offering can be really helpful. And establishing partnerships with community-based recovery support providers. So this is just a diagram that kind of talks about a lot of different recovery supports. In New Hampshire, I think we have, it's either 13 or 17 local recovery community organizations, and I will tell you how you can find those, and I will speak to some other resources as well. And I welcome you to kind of look at this graphic a little bit later, and I am happy to send out a PDF of my slides after I'm done today. I did want to highlight this case study around developing a recovery-friendly workplace. So this comes from Hypertherm. I'm not going to do too much of a deep dive on this now, but my point is mostly that it can take time, and that's okay. You really don't have to have all of the pieces in place at once. You don't have to have all of the answers. That's part of what the initiative is really here to help with, is helping you get things figured out, figure out the steps that you're able to take. We're very willing to work with your capacity. We're pretty flexible, and it's really just more about being on a continuum of culture change, and how do we take wherever you are and move you down that continuum a little bit. But just to highlight a couple of things. So at Hypertherm, who became one of our biggest champions, and Chameleon Group is as well, so we're really excited they're here with us today. But they really were motivated to get involved with this due to personal stories of loss that they experienced. And then they actually started off by establishing a task force. And then that task force identified stigma as something that was very important for them to challenge. And they did a campaign with resource cards and bracelets. And what they saw was that within a few days of putting those out, almost everybody was wearing a bracelet, and they hadn't really talked about it, and it wasn't like mandatory. And it was just a really good sign for them that they were really onto something. Then they started kind of getting into policy change a little bit more. They partnered with their EAP and a local entity to kind of bump up the amount of sessions they could offer through their EAP around substance use disorder. And then in 2018, they officially joined the initiative. They launched a website that has resources, and then kind of goes on. And then a new thing that they added is having a licensed alcohol and drug counselor actually on site for a few hours each week. And so when we're kind of thinking about this, basically there's just different options and pathways for an employee to get support at Hypertherm. So they can go to human resources, they can go to a team leader, they can go to their EAP, they can go to one of their peers who's a trained recovery coach who's more so functioning to be able to have a supportive conversation and get them connected to resources as opposed to being like a primary ongoing coach. They have resource cards in their substance use disorder website. And again, they have that licensed alcohol and drug counselor that comes on site. And this might sound like a lot, and you might not be able to do all of these things. You might be able to do one of these things or two of these things, and that's great. That's amazing. It's really about your employees knowing that they're supported, and that does not have to be, you know, an overly fancy thing. Going to run through some resources in New Hampshire. So New Hampshire, if you're not familiar, has a 211 number. Actually, all 50 states, you can call 211, and it's a information and referral line. You can call it 24/7, 365 days a year. And 211 also partners with what's called the New Hampshire Doorway System. So the Doorway System is 9 hospitals, also called hubs, around the state of New Hampshire. And so if you are looking for help with substance use disorder for yourself or a loved one, you can call 211. They'll do kind of a brief, like, it's not like a full like clinical assessment, but they'll do some kind of like a screening with you, and then they can get you connected to one of the doorways. And the doorway is going to do an assessment and kind of help you determine what level of care you need. They're going to help you come up with a plan. They're going to do a centralized intake, so then they can help you make a bunch of calls. They're also going to find out what kind of insurance you have. And so what it's designed to do is, rather than an individual having to call 20 treatment places on their own and maybe get the door slammed in their face again and again and again, which can be really disheartening, they're going to kind of shelter that person from that. And then say they can't get into treatment right away, they can kind of help them figure out a plan for what they're going to do until maybe that space opens up. They also provide case management services for up to a year after getting connected to them. Recovery community organizations are another amazing resource. So again, these provide peer-based, non-clinical support. So they do things like host recovery meetings. So one that a lot of people are familiar with would be AA, but actually there is a lot of other meetings beyond AA that people might not know about. So you can kind of look into your local recovery center to see what they're offering. Sometimes they have fun programming and events around like fitness or art. You can go to nhrecoveryhub.org and you can see where your closest recovery center is. They also provide one-on-one recovery coaching services. They also provide supports for family members who have been impacted. So really a great resource. If you want to learn more about how 211, the Doorway, and RCOs are connected and partner to serve those impacted by SUD, you can watch our video here. A couple more resources. So peer agencies, peer support agencies provide no cost peer-based support for those with mental illness. We do have NAMI New Hampshire. They provide information, trainings, and suicide prevention and postvention support. The American Foundation for Suicide Prevention in New Hampshire provides education and advocacy, also support for survivors of suicide loss. Headrest has a crisis suicide prevention line. For those experiencing a crisis, you can call 1-800-273-TALK. For general questions or to book an intake with Headrest, there's their number. And for a teen-specific hotline, you can call that number. did want to highlight some resources beyond New Hampshire for your reference in case you're ever working with someone outside of the state or for your own interest. And some of these apply even if you're in New Hampshire. So for example, if you were interested in finding a virtual All Up Recovery meeting, you can click on that link. So all recovery meetings are for people who are either in or supportive of recovery. They welcome people from all recovery pathways, meaning they're not like denominational. They're not specific to, say my pathway is AA. I'm welcome at this meeting, and so are people from other recovery pathways. And also people with any behavioral health concern are welcome. They do specialized groups, including for family members, LGBTQ+ identifying people, women and mothers, and those interested in harm reduction. You can also learn more about multiple pathways to recovery, including a variety of meeting types here. This has been something that's been really central to kind of my growth in this field and kind of understanding people who have been impacted and how to get people connected to help or how to support them. And let's see, here's just a couple other links. And again, the National Suicide Prevention Lifeline. You'll notice this is the same number as Headrest. That's because this entity partners with local crisis centers. And that's why if you're in a crisis, Headrest will just have you call that number. And if you're calling in New Hampshire, you're likely just going to get connected to them anyways, but they do that so there's really continuity. And oftentimes Headrest is actually taking calls from other areas because they don't want that phone ringing too many times before someone's getting connected. There's a text number for crisis counseling. Happy to do questions, but we also have, I can actually stop the share. I'll just put up my contact information quick. I'll also put that in the chat. I'll just mention really quick, if you want to become a recovery friendly workplace or learn more, you can check us out online and click on our Join Us tab, and then you can submit a letter of interest. So again, that's recoveryfriendlyworkplace.com. Click on the Join Us tab. If you're on social media, we have all of the social channels, and I'm going to stop my share. We have 15 minutes left, and I really want to be able to hear from our representatives from Chameleon Group. And then we probably should have some time for questions at the end.
Perfect. Thank you, Samantha. That was a great presentation loaded with resources. And I'll talk a little bit more about that in a little bit. My name is Vinny Bossy. With Chameleon Group in Dover, New Hampshire. I'm the Chief Operations Officer. Joined with me is Jeff Booker. He's one of our inside sales managers. And want to take some time this afternoon to kind of tell our story, how we got involved with the recovery friendly workplace. And we did it by accident. We were not knowing that we were becoming a recovery friendly workplace. About 10 years ago, we had an employee that was struggling to get to work on time and having issues, and we ended up having to part ways. You know, this individual just consistently, after many discussions, you got to fix this, never turned it around, and we ended up having to part ways. 5 years later, after that, about 5 years ago, this individual reached back out to us and had said, can I come by and talk with you? And I said, sure. Well, why not? You were, and then this individual was a good employee 95% of the time. It was the 5% that got her. So she came by and we had a discussion, and she said, you were not aware. And truly, we think we know what's going on within our business. We're a small business, about 35 employees. We provide outsourced inside sales services, and we think we know what's going on within our business. And this individual said, I at the time was addicted to heroin, and you had no idea. And she said, I'm in recovery. I'm in a program, 12-step program, and part of that program is to make amends for the try to right what you've done wrong in the past. And she came by really to apologize. And at the end of the conversation, she had asked if she could have her job back. And I said, yeah, you were a great employee. Other than having a hard time getting to work, you were a great employee. And yeah, absolutely, you can have your job back. She came back and she knocked it out of the park. She became one of our inside sales managers, did a great job for us. And we said, there's got to be other individuals that are in recovery, substance use disorder, and are looking for work. How do we find those individuals? Well, she said, you start to get involved with the different recovery organizations, and one thing will lead to another, and you'll have some interviews and gain some employees. And we did. And it's been a great resource for the company to gain loyal employees. I think, going through Samantha's presentation, she talked a lot about resources. She talked a lot about really open and frank conversations with your employees. Those things, that's really the key to all of this. I mean, there are a lot of companies out there that have employees that are suffering from substance use disorder, but nobody talks about it. Nobody knows about it. And we're very open to it, and people will come out, we'll have an interview and somebody will say, I appreciate you being a recovery friendly workplace. In the past, I have suffered from addiction. And that's not, that wasn't part of the conversation. They openly came out and had that conversation with us. So for us, it's really been a great source of loyal employees. I think that the key to all of this, we were doing this before there was a recovery friendly workplace initiative in place, is understanding your resources. And that's why I thank Samantha at the beginning of this, of my part of the conversation, because understanding those resources and knowing where to go, you're not going to understand it all. There's going to be challenges, and knowing where to go, or at least knowing who to go ask. If I have a question, who do I go to ask? And you become very involved with the recovery centers that are in your proximity. You become, in a lot of cases, we've become very friendly with the drug courts for both Stratford County and Rockingham County. At the end of the day, I've found it very rewarding to be involved with the recovery friendly workplace. So much so that we'll have we'll have an employee that's going through the drug court system, and we have the opportunity to go to their graduation, and to see that individual graduate and know that you've supported them through that is really, really rewarding. So I'll take a little break here, and I'll let Jeff kind of introduce himself and his role here at Chameleon Group.
Hi guys, thank you, Vinny. That was very good, very nice. My name's Jeff Booker, and I'm an inside sales manager here at Chameleon Group. And I wasn't the first recovery-friendly workplace employee, but I believe I was the first one that was actually actively in drug court when I came to Chameleon Group, and we kind of had to learn through that process together, what it looked like, what it felt like, and everything like that. And I came to Chameleon Group as a business development representative. And I've since worked my way up to an inside sales manager. I've been here for about coming on 4 years now. I came in basically fresh out of rehab and worked hard, stayed diligent, and now, like I said, I'm an inside sales manager. I just purchased my first house. Mm-hmm. I come to work every day. I love it, and learning new things every day. I'd never done sales before previously in the past, but lo and behold, addicts or people in recovery are very flexible, and having to deal with a lot of different either tragedies or hardships in your life and overcoming them in recovery or in addiction actually prepare you for that in business or just in life, period. So it's not been an easy road, but it's been a road I would have never ever thought in 100 years I would have taken, but I'm glad I'm where I am now and couldn't be happier, honestly.
Yeah, so Jeff's Jeff's one of those success stories, and something that we're very proud to be involved with. I think as sometimes businesses look to other businesses to say, how did you do it, or how did you tackle this challenge? So if anybody has any questions, they're more than welcome to give me a call. You can connect with Samantha and get my contact information, and more than happy to help out any way I can.